There is a type of headache that many adults after 60 quietly learn to live around. It is not always severe enough to stop the day. It may begin as pressure behind the eyes, a dull ache across the forehead, or a heavy sensation that appears every afternoon. 2 tablets reduce it. A cup of coffee makes it easier to ignore. By bedtime, it has faded just enough to be forgotten. Then it returns the next morning. The first explanations seem reasonable. Poor sleep, eye strain, stress, sinus pressure, a stiff neck. Perhaps the blood pressure is slightly high. But over the following weeks, other changes begin appearing beside the headache. Walking upstairs leaves you unusually breathless. Your heart pounds after mild activity. Your tongue feels sore. Your fingers tingle. Your balance is less certain in a dark hallway. Familiar names take longer to remember. Because every symptom can be explained separately, no one places them together. What almost nobody realizes is that a persistent headache can sometimes be one part of vitamin B1-2 deficiency, particularly when the deficiency has progressed far enough to interfere with healthy red blood cell production. When the blood cannot deliver oxygen efficiently, headache, dizziness, fatigue, breathlessness, and palpitations can follow. At the same time, the deficiency can begin damaging the nervous system, producing numbness, tingling, weakness, balance problems, confusion, or memory changes. That combination is what makes vitamin B1-2 deficiency so deceptive. After 60, it can imitate anemia, neuropathy, depression, aging, medication effects, and even early neurological disease. And the longer nerve-related symptoms continue, the less certain it becomes that every change will disappear completely after treatment. But this warning must begin with an even more important truth. A new, persistent headache after age 50 should not automatically be blamed on a vitamin deficiency. Neurological guidance identifies a constant new headache in someone over 50 as a reason for medical evaluation, because secondary causes become more important with age. These include medication effects, infection, glaucoma, blood vessel disease, cancer, bleeding, and an inflammatory condition called giant cell arteritis. The deficiency is therefore not the first conclusion. It is one of the treatable possibilities that can remain hidden after urgent causes have been considered. There are 3 headache patterns worth separating. The first is a new emergency pattern. The headache reaches maximum intensity suddenly, feels unlike anything experienced before, or appears with weakness, numbness, slurred speech, confusion, loss of balance, fainting, seizure, fever, a stiff neck, or a significant change in vision. That pattern requires urgent evaluation because stroke, bleeding, infection, or another neurological emergency may be present. The second is an inflammatory artery pattern found almost exclusively in older adults. A new headache develops around one or both temples. The scalp becomes tender when combing the hair. The jaw begins hurting or tiring while chewing, and vision may become blurred, doubled, or suddenly reduced. Unexplained fever, fatigue, loss of appetite, or weight loss may occur beside it. That condition is giant cell arteritis, also called temporal arteritis. It involves inflammation and damage in blood vessels supplying the head and eyes. Treatment must begin quickly because delayed care can result in permanent vision loss or stroke. No vitamin supplement should be used to test whether that pattern improves. The third is the deficiency and anemia pattern. The headache is usually accompanied by a broader decline in the body's ability to carry oxygen or maintain normal nerve function. The person may look pale, become breathless during ordinary activity, hear the heartbeat pounding in the ears, feel dizzy after standing, or lose stamina that was present only months earlier. If vitamin B1-2 is involved, additional clues may appear: a smooth or sore tongue, numbness, pins and needles, difficulty sensing the floor, unsteady walking, confusion, poor memory, irritability, or weakness. These clues are not proof, but together they form a pattern worth testing. To understand why a deficiency in one vitamin can affect both the head and the feet, you need to understand the 2 jobs vitamin B1-2 performs. The first involves blood. Vitamin B12 is required for normal DNA production and the formation of healthy red blood cells. When the supply is inadequate, developing blood cells can become unusually large and ineffective, producing a form of anemia known as megaloblastic anemia. Anemia means that the body is not receiving enough oxygen-rich blood. The brain is highly sensitive to changes in oxygen delivery, so headache, dizziness, weakness, breathlessness, and an irregular or pounding heartbeat can develop as the body attempts to compensate. The second job involves the nervous system. Vitamin B12 helps maintain normal nerve function. A deficiency can disturb the protective structures surrounding nerves, creating tingling, numbness, balance, difficulty, slower thinking, and other neurological changes. This is why the headache should not be considered in isolation. A daily headache plus pale skin tells one story. A daily headache plus numb toes and unsteady walking tells a broader one. The deficiency may also be present before dramatic anemia appears. A normal-looking hemoglobin result does not necessarily answer every question about B12 status, particularly when neurological symptoms are developing. Clinicians may therefore consider the blood count, serum B12 level, symptoms, medical history, and, when needed, additional markers such as methylmalonic acid or homocysteine. Kidney function can affect the interpretation of some of those markers, especially in older adults. I want to tell you about a woman I will call Judith, a representative composite rather than one identifiable patient. Judith was 70, a retired piano teacher who had always begun her mornings with an hour at the keyboard. She first noticed the headache during winter. It felt like a tight band above her eyebrows and usually appeared before lunch. She blamed the dry heat inside the house. When spring arrived and the headaches continued, Judith scheduled an eye examination. Her prescription had changed slightly, so she bought new glasses and expected the pressure to disappear. It did not. Several weeks later, she noticed that her right hand sometimes felt numb while playing. The sensation involved the fingertips she had trained for most of her life. She began striking the keys harder because she no longer trusted how firmly she was touching them. Judith assumed arthritis was changing the way her hands felt. Then the staircase became difficult. She could still climb it, but her heart pounded at the top. She stopped carrying laundry upstairs and began resting halfway between floors. At night, her feet tingled beneath the blankets, and she occasionally steadied herself against the wall when walking to the bathroom. Each symptom received a different explanation. The headache was her eyes. The breathlessness was age. The fingers were arthritis. The feet were poor circulation. The balance problem was tiredness. At a routine appointment, Judith mentioned the headaches, but not the rest. Her blood pressure was slightly elevated in the office, so she began checking it at home. Most readings were not high enough to explain constant pain. The headaches continued, and over-the-counter pain medicine began appearing more frequently in her morning routine. That introduced another possibility. Repeated use of pain medicines can sometimes contribute to medication overuse headaches, creating a cycle in which treatment of the pain helps sustain the pain. But even that explanation did not account for the numbness, breathlessness, and balance changes. The pattern became visible only when Judith's daughter watched her cross a dark restaurant. Judith moved cautiously, looking down at her feet, as though she could not tell exactly where the floor was. During dinner, she pushed food away because her tongue felt tender. Her daughter wrote down every change and brought the list to the next appointment. Because Judith was over 60 with a new persistent headache, the clinician did not begin by assuming vitamin deficiency. Questions were asked about sudden onset, vision loss, jaw pain, scalp tenderness, fever, weakness, speech changes, cancer history, head injury, and other neurological warning signs. Her eyes, strength, sensation, coordination, walking, reflexes, and cranial nerves were examined. The evaluation then expanded to the blood. A complete blood count showed anemia, and the red blood cells were larger than expected. Her vitamin B12 level was low. Additional testing was used to clarify the diagnosis and investigate why the deficiency had developed. Judith believed that answer made no sense. She ate meat, eggs, and dairy products. She was not starving, and her diet did not appear obviously deficient. But vitamin B12 deficiency after 60 is often not simply a problem of failing to eat enough. Many older adults produce less stomach acid, making it harder to release naturally occurring B12 from food. Autoimmune gastritis can damage the stomach cells involved in B12 absorption. Pernicious anemia develops when the body cannot produce or use enough intrinsic factor, a protein required for normal absorption. Gastric surgery, intestinal disease, long-term metformin use, and prolonged use of acid-suppressing medicines can also increase risk. Judith's testing was consistent with pernicious anemia. The name comes from an earlier period when the condition could become fatal because effective B12 treatment did not exist. Today it is treatable, but the danger has not disappeared entirely. Untreated deficiency can continue affecting blood formation and the nervous system, and some neurological symptoms may not fully resolve even after B12 is restored. Judith began replacement therapy selected by her clinician. Because her absorption mechanism was impaired and neurological symptoms were present, the initial plan included vitamin B12 injections, followed by ongoing treatment and laboratory monitoring. The headaches improved over the following weeks as the anemia was corrected. Her stamina began returning. The tongue tenderness settled. The pounding heartbeat became less noticeable. The numbness and balance problems changed more slowly. That slower recovery taught Judith the most important part of the diagnosis. The headache had been uncomfortable, but it was not necessarily the most dangerous symptom. It had been the signal that finally led investigators toward a deficiency already affecting the nerves. Before I continue, let me ask you something important. Have you ever made a major decision while feeling worried, rushed, or unsure which information you could trust? That is how costly mistakes often begin. A frightening headline can influence your investments. Conflicting health advice can leave you confused. A convincing salesperson, online scam, or emotional family situation can pressure you into acting before you have checked the facts. And after 50, the consequences can be much greater. One poor decision may affect your retirement savings, your health, your independence, or your peace of mind for years. That is why I want you to take a look at the decision trap. It is a practical guide designed to help adults over 50 recognize fear, manipulation, hidden bias, misleading information, and high-pressure tactics before making an important decision. Inside, you will find a simple step-by-step system for slowing the situation down, checking the evidence, asking the right questions, comparing your options, and protecting yourself from mistakes that could become expensive. Do not wait until a bad decision teaches you the lesson and the hard way. Click the link in the description and get your copy of the Decision Trap now. Then come straight back, because the next part gives you 4 specific details to record when a new persistent headache appears after 60, and the exact wording that can help your doctor see the full pattern instead of treating each symptom separately. There are 4 details worth recording when a new persistent headache appears after 60. The first is timing. When did the headache begin? Was the onset sudden or gradual? Is it present on waking? Does it worsen through the day? Or does it appear during physical activity? Does coughing, bending, exertion, or changing position make it worse? A headache beginning for the first time after age 50 deserves evaluation even when the pain is not severe. The second is location and associated symptoms. Temple pain with scalp tenderness, jaw pain during chewing, or visual changes requires urgent attention because of giant cell arteritis. A sudden explosive headache, neurological weakness, confusion, speech difficulty, or severe imbalance requires emergency assessment. The third is the anemia pattern. Notice whether the headache appears beside unusual fatigue, pale skin or mouth tissue, breathlessness, dizziness, chest discomfort, a rapid heartbeat, or reduced exercise tolerance. These findings can occur when the blood is no longer delivering oxygen normally, but anemia has many possible causes and should not be treated without identifying the reason. The fourth is the B12 nerve pattern. Mention numbness, tingling, burning feet, weakness, balance changes, memory problems, confusion, depression, or a sore, smooth tongue. These symptoms can come from diabetes, thyroid disease, medication effects, spinal problems, stroke, or other neurological conditions. But they change the evaluation when they occur beside anemia or recognized B12 risks. The useful phrase at an appointment is not, "My headache means I have a vitamin deficiency." It is more precise. "I am over 60 and have developed a new persistent headache. I also have fatigue, breathlessness, numbness, balance changes, or tongue soreness. Could anemia or vitamin B12 deficiency be contributing?" While we also evaluate the more serious causes of a new headache at my age. That sentence does not force one diagnosis. It makes the entire pattern available. Do not begin high-dose folic acid simply because a blood test shows enlarged red blood cells. Folic acid can improve some blood abnormalities, while an untreated B12 deficiency continues damaging the nervous system. The cause should be identified before one nutrient is used to cover the laboratory evidence of another. Do not assume that taking a standard multivitamin proves absorption is normal. A tablet cannot guarantee that B12 is reaching the bloodstream when intrinsic factor is missing, or the stomach and intestine cannot absorb it effectively. And do not wait for the headache to become unbearable. Pain intensity does not always measure medical importance. Giant cell arteritis can threaten vision before the headache becomes extreme. B12 deficiency can damage nerves while the headache remains dull. Anemia can place increasing strain on the heart while the person continues treating the symptom with pain relievers. Judith's headache did not contain the name of her diagnosis. It contained a warning that something had changed. The answer was not hidden only inside her head. It was hidden in blood cells that were developing abnormally, in nerves losing normal function, and in a stomach no longer providing the mechanism needed to absorb an essential vitamin. Constant headaches after 60 are not automatically caused by vitamin B12 deficiency. Most cannot be diagnosed by symptom pattern alone, and many have completely different explanations. But when a new headache arrives beside fatigue, pallor, breathlessness, numbness, balance problems, memory changes, or a sore tongue, the deficiency becomes too important to ignore. The pain may be the symptom that finally earns attention. The dangerous part may be what has already begun happening everywhere else. Before you leave, understand what is really at risk. The cost of this guide is small, but the cost of one rushed financial decision, one misleading health claim, one convincing scam, or one panic-driven reaction can be far greater. It can cost you money you spent years saving. It can cost you confidence in your own judgment. And in some cases, it can cost you your independence and peace of mind. The decision trap was created to help you recognize pressure, fear, hidden bias, and misleading information before they influence an important decision. You may not need this guide every day, but on the day you face a decision that could affect your savings, health, or future, not having a clear system may become far more expensive than getting one today. Click the link in the description and get your copy of the Decision Trap now, because the best time to protect yourself from a costly mistake is before you make it.